and we are here again to learn and to educate ourselves and also share with our mothers, our sisters, and our friends. And for our husbands and our supporting partners, we are also saying that learn so that in case we don't see some of the observations, we will be there to observe and also alert us. But before we do our education, today we have something new for all our viewers. You know, we have our new baby on the market. So, this new baby, we have our pink and our blue. So, this is the new baby on the market for Customs Baby. And we have three important things that makes our head to toe body wash for our babies so different from the others on the market. It has a gentle hypoallergic formula that doesn't irritate the eyes or the body. At the same time, also is good for a baby's delicate skin and has a unique mood scent fragrance, which is just pretty and smells good and create that sense of calm and comfort to the little ones. Then the third one, it also makes the mother feel okay. It makes the mother feels okay. So we are just telling everyone watching us, it's so affordable and you can get it at all Melcom shops and all mother care shops throughout the nation. So go get one for yourself and for the baby. Thank you. So we have the pink and we have the blue. Not necessarily pink is for a boy or a girl, but the blue, both blue and pink can be used for both boys and girls. Today, to our topic, we are here to talk about diabetes in pregnancy. Diabetes in pregnancy. Somebody will say, why did we choose that topic? We've realized that most of the mothers, she will say, oh, I'm not having, my mother is not, my father is not. How come by 24 to 28 weeks, my sugar starts going up? Yes. So the cause is unknown, but diabetes in pregnancy is also known as gestational diabetes. And it starts from 24 to 28 weeks. So that is the crucial moment a mother can develop diabetes in pregnancy. And you know, when it starts, you feel so uncomfortable. You even get upset because you don't even know how come your sugar level started going up. And the cause is unknown. Nobody knows the cause. But at the end of the day, the placenta, where the baby takes its nutrients from, that is where the problem starts, because at the end of the day, the insulin tolerance of you, the pregnant woman, becomes so low that at the end of the day, the amount of glucose that the body needs to absorb and also what you need to give out becomes slow. Then we also know that naturally when you get pregnant, your body is for 2 or 3 or 4 or 5 human beings at a go till your baby or your babies comes out. We're also saying that immunity naturally also comes down. That's why it's recommended that when you get pregnant or you miss your period exactly 4 weeks, you don't sit home and say, I'm waiting for a while before I go to the clinic. No. Rather, when you miss your period, you visit your healthcare provider, that is your doctor or your midwife, and report that I've missed my period so that laboratory test can be done. And your first sugar level that is done is the first laboratory examination that you do. So it gives the midwife or your doctor or your care provider that baseline for him or she to know where your sugar is. Either a random blood sugar is done or a fasting blood sugar is done, so that it gives them a fair idea of who you are, so that when at the end of the day it's done and you are being monitored throughout the journey of the pregnancy, immediately the sugar start changing, you will know that there is a problem somewhere. And as soon as possible, the care will be given to curb that situation. So the first sugar is done exactly when you visit the clinic for the first time. Then between 20 weeks to 28 weeks. So because it's 4 weeks, 4 weeks, 4 weeks, it can be done at 20 weeks, it can be done at 24 weeks, it can be done at 28 weeks. For us to know that if still you are in the range. Now, aside that also, when you go for antenatals, they check your sugar by testing your urine. The algostics, the one the midwife dip into the urine to check your sugar and your protein. Reason being that diabetes and hypertension, they are twins. They work hand in hand. So the sugar is for the diabetes and the protein is for the hypertension. So that at the end of the day, we know when to act, when to encourage, and when to also let you know that at the end of the day, your pregnancy is smooth sailing and you are getting closer with no complications, with no problem. Then also, when the sugar is tested in your urine and we realize either it's trace, either it's 1 plus, 2 plus, 3 plus, 4 pluses as it goes on, and then another additional test will be done. That is OGTT, that is oral glucose tolerance test, OGTT. So how OGTT is done, you do it in the lab. So we want to know your glucose tolerance. So how the body is able to produce the insulin so that it can work on the glucose. We know the fast rate that it works on. So we know if your body can tolerate enough glucose or not. So at the end of the day, when you go to the lab, before you do the lab, they take your first sample, which you haven't eaten at all. And they have ranges you need to fall within. So when they take the lab sample and they run the test, they know the range you are in. They'll give you glucose solution. They'll wait for 1 hour, they test. They'll do another top up, they wait for another hour, they test. Then so the ranges will see how your body is able to produce the insulin. Some you check the urine, oh, the sugar is maybe 1 plus. You go and do the oral glucose tolerance test. You are in the range. When you bring it and your doctor says you are okay, but you need to modify your diet. The diet is very, very important as a pregnant woman. Our foster diet is so important because at the end of the day, there are things that you have to eat, things that you have to abstain, and things that you also have to eat in moderation. So at the end of the day, we look at all this to give you the best solution so that you come out of the gestational diabetes. Then research also has shown that between 3 to 4% of pregnant women always develop gestational diabetes. And we also know that women who develop gestational diabetes 40 years and above are only the whites, but 25 years and above are the blacks, which is the Africans, the African Caribbean, the Asians. So you realize that I fall in, you fall in the 25 years and above. Ours start very early. So you wouldn't be sure the 25-year-old mother has been diagnosed gestational diabetes. Whilst a white it will be about 40 years, which at the end of the day, when you pick 10 pregnant women who are about 40 years for a white person, you can only get maybe one. But when you pick a pregnant woman who is black or Asian or African Caribbean, you realize that at the end of the day, you can get as much as maybe 4 mothers out of the 10 or even 5 out of the 10 who will develop the gestational diabetes. Research also has shown that mothers who develop gestational diabetes, after 5 years, if care is not taken, they will develop type 2 diabetes. So, we also know that mothers who develop gestational diabetes, they can have a normal vaginal birth if they adhere to the management, if they are able to do what their midwife or their doctor is able to tell them to do. Some cases, they don't have the vaginal birth. They end up at the theater and having a cesarean birth. All is important because at the end of the day, the bottom line is we want mother to be safe and baby also to be safe. Mothers who also develop gestational diabetes are likely to give birth to babies who are very big. So babies who are more than 4.5. And those babies are called macrosomic babies. So they are very big. So you realize that even those babies, possibility that they can have congenital defects, some babies do develop, especially heart conditions, others don't. So you know all this at the back of your mind, you know that these are some of the things that happens that a mother can experience when she's suffering from gestational diabetes. We're also saying that the cause is unknown. Nobody knows the cause. But if you go to antenatal early, you adhere to your prenatals, you follow your tetanus regimen, you take your SPs, you sleep under the treated mosquito nets, and at the end of the day, you visit the clinic regular when you think something is not right with you and your baby. If your baby, the number of kicks the baby is supposed to kick, the baby has not kicked that much, and you rush or you call your midwife and you alert her. At the end of the day, I think so many things can be done to save you and the baby. We also know that at the end of the day, no baby. I would like to read something more for my viewers for them to also know. No mother or no baby is supposed to be lost when you get pregnant. No mother, no baby. We are not supposed to lose you out of pregnancy. You are supposed to walk through the journey 9 months and come out successfully with your baby. That's why we at Customs Baby always comes your way with this health program for you to know that we care about our mothers and we care about our babies and we care about the happiness of the home. That's why we bring this to you. And we're also saying that if care is not taken and your gestational diabetes is not controlled, possibility that we can lose the baby is high. So we can lose the baby before the baby is born, or after 2 weeks when the baby is born, we can equally also lose the baby. So this is the time period. So there can be stillbirth, baby will be born dead, or after 2 weeks. Gonna do this, somebody will say, oh, she delivered, we came home nicely, nothing was happening. Exactly 2 weeks, she lost the baby. When you probe further, you know that the mother, one way or the other, suffered from a condition. And at the end of the day, she lost the baby. But thanks be to God, there is science now. And science has taught us that early detection also saves life. That's why when you miss your period, you need to go and see your health provider. Now, there are signs and symptoms that you, the mother, you start experiencing. The first one is you feel thirsty very often. You feel like visiting the washroom as often as possible, like every minute I need to go, every minute I need to go. You have the dryness of the mouth, you feel so tired, you start having dizzy and fainting spells on and off, on and off. And at the end of the day, also, you can't even control your hunger. Some mothers will also say that they sweat a lot in their palms and under their feet. Then when they pass the urine, they feel the urine smells sugary, like the smell of the urine, you can smell sugar in it. That's what some of them will also tell you. And we also know that somebody will say, can my urine determine if I have gestational diabetes or if my sugar level is going up? Definitely. That's why when you go for antenatal, anytime you visit your midwife or your doctor, you check your urine. The urine check is every time you visit your midwife or your doctor, so that we will know if your sugar levels are going up or not. But for us to check the ordinary sugar that we do per the blood, we do it on the first time you visit the clinic. Then either 20 weeks, 24 weeks, or 28 weeks, we will know if the sugar is escalating or not. We are also saying that at the end of the day, diabetes and pregnancy, you can come out of it. You can have a bouncing baby boy or girl. You, the mother, will stay alive and also breastfeed your child. Now, I chanced upon a question from a mother. She sent it to me through WhatsApp this weekend, and I just want to share with you. The question is, I have realized that anytime I get pregnant, actually, she has miscarried twice, and this is the third one that she's carrying. Immediately is 20 weeks. My sugar goes up and it cannot be controlled till I miscarry my baby. What do I do? Now, then I told her, where does she go for antenatal? Has she given the midwife the history that she is having? She said she doesn't go to one place or the other. Actually, it was a telephone conversation, actually. And I said, okay, so now what you can do currently as at now, because you are pregnant again and you are only 8 weeks pregnant, is one, you should see a dietitian or a nutritionist. You should also talk to your midwife or your doctor, because I know when you talk to your doctor or your midwife and you let her know if this episode has happened more than once, they know how to help you to go through the pregnancy journey. Then you need a nutritionist or a dietitian, because they need to draw a diet plan for you so that you follow that diet, so that the sugar can be where it is till you have your baby. And she said, oh, really? I said, yes, because the dietitian, they have a way of, sorry, they have a way of helping you to use a diet to manage the sugar, that the sugar will never go up till you deliver, because they'll draw the diet plan, the quantity of carbohydrate you're supposed to take, the quantity of protein, the water, the fruits, the vegetables, the oil, all those things. They have a way of drawing a plan for you so that you adhere: morning, breakfast, afternoon, your lunch, then your supper. And with all this also, it's time bound. There's time allocated when you are supposed to eat. In between, you have snacks. The snacks are going to be dry snacks. It wouldn't be that luxury you were having before you get pregnant. If you're able to follow, at the end of the day, you have your baby and you have yourself. So you bear in mind that anytime you get pregnant, you don't sit at home. Rather, you have to rush to the nearby clinic, because you know your history already. Nobody needs to tell you your history, you know, so that you adhere to what you'll be told. And she was glad to know, because actually she didn't know there's supposed to be a diet for her. She didn't know she's supposed to open up to her midwife or the doctor who will take care of her. She also didn't know that immediately you miss your period, because of the problem or the predisposing factors that she already has, she needs to go to the clinic. So this is something we can all take home and also use. Then somebody will ask, who is at risk to have gestational diabetes? So if you have a heart condition or you suffered any heart condition before, if you have high blood pressure, or you have pregnancy-induced hypertension, possibility that you can also suffer pregnancy-induced diabetes is also there. Then if you are inactive, you are pregnant, or you are not pregnant, before even you got pregnant, you are somebody who sits somewhere quietly. It happens, I had opportunity to visit a country, and I sat at a big building. That building has offices, it has mall, it has everything. But I realized that every 5 minutes, you see the workers, they come out in pairs. They walk around. It's a big mall, like an office. It's very big. They walk around it. There's a circular thing, they will walk around it. Then they go back to their office. They walk around, they go back to their office. So one person was passing and I asked, why do you do this? The person said, because we sit for long. If we don't exercise, one, the food that we eat cannot digest early. Two, we can develop conditions like diabetes or hypertension, because when we walk, the body is able to move. All the organs is able to work at their normal rate. But when you sit, all the organs is at rest. So instead of the body to produce enough insulin so that the sugar which is produced, it will break it down for the body to assimilate, the rest should come out. Rather, less insulin will be produced and the sugar cannot break down and it will be stored, and at the end of the day, it will cause harm to them. And the food they also eat has fat. At the end of the day, they want it to digest also fast. Even though they've added fibers to their diet, they want it to digest so that they don't get obese. So we can also pick a clue. Those of us who work at the office, those of us who sit for long at places, when you sit for a while, just about 1 hour or 30 minutes, just try and stand and stretch, walk around for about a minute and sit. Then also those who are obese. So if your body mass index or your weight is more, when we calculate your weight and your height is more than the actual figures, you should know that you are obese. Possibility that you are at risk that you develop diabetes in pregnancy is also high. We are saying also, if you have a family history of diabetes or gestational diabetes, possibility that you can develop SI. Then polycystic ovary also. If you're a woman and you have that, you've been diagnosed of polycystic ovarian cyst, possibility that if care is not taken, you get pregnant, you can develop diabetes in pregnancy, is also high. Then if you have a history that fluctuates, that is, your sugar can go up, you go for treatment, you're okay, then they wear you off the treatment. Then the sugar, maybe after a year, it starts going up again. Then you go back again. So if you are that kind of person, possibility that you can also develop um, diabetes in pregnancy is very high. Now, I have another question. I like to answer my question whilst I go along, because at the end of the day, some of the questions come to me personally, and I always like to keep it. So, a mother also asked me, is there a way to prevent gestational diabetes? I said, yes, there is. There is a way of preventing it. So the way is eating healthy. That is our 4-star diet. 4-star diet, which we all know, it has carbohydrate, protein, the vegetables, fats and oils, and water. So it should be proportional. Then also there's a key component when you are pregnant. That is rest and sleep and exercise. Aside the diet, when you add rest and sleep and you add exercise to it, you can prevent gestational diabetes. So if in the morning you know, oh, I like wache, so you take your wache has carbohydrate, it has protein, it has your veggies, it has fats and oils, then you have your water. After the wache, at least try and stretch for about 10 minutes. Also, if you work in an office and you work and work and work and work and work, try and take a break. I know some companies, what they do is if you are pregnant, they have a restroom for pregnant women. So what they do is if you work for a while, there's a time that they will give you to go and rest for about 30 minutes, then you come back to your desk. You can also take in between 5 minutes rest also. Always elevating your legs when you are taking your rest. Then when you get home, try and eat early. It's one of the ways of preventing gestational diabetes because when you're pregnant, your immunity naturally comes down. So you have low immunity, digestion is slow than when you are pregnant. Everything about you is slow. So the earlier you eat, the better. At least between 5 to 6 p.m., you should take your supper. In case you crave for anything, that you feel you're hungry, that's why you need lots of fruit near you. Any fruit of your choice will do. And you should also pay particular attention to the fruits you eat. Some of the fruits you eat, you realize that your sugar goes up slightly. There are some fruits also you take, it doesn't alter the sugar. So let's pay critical attention to the fruits that we take. So these are the um, healthier ways that we can do to prevent gestational diabetes. So these are some of the healthier ways that we can do. And even before you get pregnant or you decide to even have a baby, I think the healthier way you can start it even before you conceive. Because if you know your body chemistry very well, there are some mothers, even before they have to get pregnant, they need to share weight, like they need to lose the weight, they need to stay away from sugar before they can conceive. Others, they don't need to stay away from anything, they are good to go. So when you know how your body works and works perfectly well, then you can take some decisions for yourself. So I hope I've answered your question, Abna. So let me go to Mavis also. Mavis, Mavis' question was, does eating too much sugar cause gestational diabetes? Okay, so does eating too much sugar cause gestational diabetes? Okay, so gestational diabetes is not directly caused by consuming sugar. No. You know, the food that we eat, everything that we eat has sugar in it. It has alcohol in it. Now, when you are pregnant, naturally, the body produces sugar. Naturally, you don't even have to eat sugar, it produces it because of the placenta. So, another school of thought will tell you that it's advisable even when you are pregnant, avoid anything that is sugar because what the body needs at that particular moment for the baby, the placenta is helping you to produce it. So why do you need to eat foods that has high sugar content or adding more sugar to the diet that you are eating? So consuming it indirectly doesn't cause diabetes in pregnancy. As when the insulin, which is produced in the body, is not sufficient enough to break down the sugar so that what it needs, the body will take it. What it doesn't need, it needs to be excreted. So it needs to come out. So if it's not coming out and it's being stored, that's what happens to your urine. They will check, the sugar is up, 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 up. You go and do your OGTT, your body even can't tolerate. Even they will even just give you just 1 cup. You take it, they're expecting you the next the quantity that needs to break down. Like it doesn't break down, it stands where it's standing. They add additional 1 hour to it, it's still the same. Additional 1 hour to it is still the same. That is telling us the baby's life is at risk, including you, the mother. Then maybe it's also ask this question: can skinny people get gestational diabetes? Oh, yes. Even though I said obese, when you take 1 out of 10 skinny people, you can get one who can experience, or two, gestational diabetes. At the same way, anybody who is also obese, when you take 10 mothers who are obese, the likelihood that 9 out of 10 can develop gestational diabetes is high. It's high. So even there are some skinny people who have hidden fat in them. You'll be shocked somebody will be slim. She'll stand on the weighing scale. You see the weight, you'll be amazed. You look at her like you think the scale is wrong. You readjust the scale, the person stands on it. The person tells you, I'm not having anything on me which is heavy. There are some people who are skinny, who are heavy. And there are some people who are plumpy or fat or obese. They stand on the scale. They are not that heavy like you think. So we shouldn't think if you are skinny or you are slim, you can't experience gestational diabetes when you are pregnant. So prevention is better than cure. So since we know all these things that needs to take us out of gestational diabetes, we should just pay critical attention to it and do the same. Then um, I want to take another question. Somebody also asked me, how early do you deliver with gestational diabetes? So when they realize that the sugar or the glucose, you are not able to produce enough insulin, the sugar keeps on escalating, and we realize baby's weight is adequate for us to take the baby out. Between 36 weeks to 39 weeks, any medical doctor will advise you should allow them to either induce you to push your baby or you go to the theater for them to have a cesarean birth. So any of them is good for you. Anybody watching me, if your doctor says or your midwife refers you to see a doctor and the doctor tells you because of your baby, any mode of delivery or method of delivery which is recommended to you, and you discuss with your spouse, definitely they will tell you the positive side and the negative side. Please, anyone they recommend, please go for it. Save yourself and save your baby. Save yourself and save your baby. So, I think I have answered most of my questions. Yeah. The questions that I have, I think I have, I have, I have, I have, yeah. Okay. So, um, yeah, okay. I have answered all my questions. So, because some children can develop fetal abnormally or abnormal conditions whilst they are in utero, that's why when you go for antenatal, by 28 weeks, a scan is taken to check the fetal abnormality of the baby. That scan is so important so that you know the child that you are coming to give birth to, if there's a problem. Because some children, as early as 24, 26, 28 weeks, they develop heart conditions, especially mothers who have gestational diabetes. Most mothers, the conditions that their children or the baby suffer from is heart conditions. Some, it's not that serious. Prevention or measures can be put into place to solve that problem. Some, it's so serious that an advice will be given to the couple so that the way forward is also taken for both of them. The bottom line is heart condition with children is not easy to deal with. Those babies, majority, end up in the NICU, the neonatal intensive unit. Babies who are also born from mothers who are suffering from gestational diabetes are likely to come out with low sugar, that is hypoglycemia. So when they come, you see that your baby is crying. The next moment, your baby is going. The baby will start turning into blue, and we can equally also lose the baby. So those babies, immediately they come out, we check for their sugar. And if the sugar is so low, we put the baby to breast. Measures is also being taken by giving the child medications and making sure that the child sugar will be in the normal range so that we wouldn't, and we will never lose that baby. I have witnessed so many encounters. The baby will come, the baby is crying nicely. They hand over the baby to you, especially if it's CS, they hand over the baby to you. By the time you realize, the baby starts turning blue. And normally it starts from the extremities, either the upper or the lower. SBD also, I've also witnessed so many ones. Baby is crying, you are trying to dress for the baby. You realize the baby starts turning into blue. So immediately baby comes out. One of the protocol is we check the sugar. The first thing we do is to check baby sugar because we know the history of the mother already and we don't want to lose the baby. So at the end of the day, we check the sugar of the baby and we know the measures we need to put in place. Then I think I have this one also here. Oh, yeah. So a mother asked me, how worried should I be about gestational diabetes? Okay, so you should be worried. You should be extremely worried because possibility that if it's not properly managed, in the next 5 years, you can develop type 2 diabetes. If it's not properly managed, possibility that you can give birth to a child that by 2 weeks, the baby is no more. Or that same day, you can lose the baby. Or you can deliver a baby who will even die in the uterus before its time. So you should be concerned if you are being diagnosed or you are diagnosed gestational diabetes or diabetes in pregnancy. Anyone goes. Then, one thing also we should always remember that when you are pregnant, your body changes. The way your body works, the chemical reaction in your body, the way your body even reacts to so many things that you put in changes. So our diet plan should also change. Our eating habits should also change. Our focus towards seeking antenatal or maternal health care should also change. Because gone are those days you can say, let me wait 6 months before I go for antenatal. It doesn't work like that anymore. Now, how it works is when you miss your period, you visit the clinic. When your midwife or your doctor gives you medication, you take it religiously. When you are being referred to a nutritionist or a dietitian, they give you an appointment, you adhere to the appointment. They give you management on how to manage yourself and the baby. You adhere to it. When they ask you to come for a revisit, you do just that because you are not working alone. It's either you, your baby, or your babies. When you look on my screen, you will see hair and body wash with mood set. Being I told those who didn't join us from the beginning, this are new baby on the market. A hair and body wash from head to toe. It doesn't irritate the skin. It makes baby soft to touch. Baby smells good. It doesn't change the skin color. It makes the baby comfortable in his or her own skin type. And always, baby's always happy when it's time for you to take baby's bath. You know, there are some babies when it's time for you to bath them, everybody will hear that you are bathing for your baby. Yes, it depends on the product you are using. But with our product, you wouldn't even hear. All you hear is laughter, joy, that the baby is actually enjoying the bath. When it's even over, baby still wants more because it doesn't cause any allergy. It doesn't. There are some products you use, you realize that by the time you finish bathing for your baby, either baby is suffering from cold or runny nose. But with this, it's not like that. So let's go out and buy. Like I said, you can get it at all Melcom shops nationwide and also all mother care shops nationwide. And it's affordable, so everybody can buy. It's for everybody. And because we are proudly Ghanaians, we think about Ghana and we know that everybody counts. So today, we've learned a lot. We've known that gestational diabetes can be managed, it can be prevented. The cause is unknown. But what we also know is when you are pregnant and placenta starts developing, at the end of the day, the tolerance of your glucose level comes down. That's why the placenta produces enough sugar naturally for the baby to survive on, for the mother to also survive on. We also know that if your body cannot produce enough insulin so that it will break down the sugar that you produce, possibility that you can get gestational diabetes or you'll be diagnosed with gestational diabetes is high. We also know that between 3 to 4% of mothers who are pregnant can be diagnosed with gestational diabetes. We also know that we Africans or blacks or Caribbean blacks or Asians are more at risk because it starts from age 25 and above. The whites starts from 40 years and above. So if I am a black person, I'm an African, and I know that I'm at risk, what are some of the preventive measures that I can do? One, I should monitor my diet, monitor my lifestyle, and make sure that when I'm pregnant and I miss my period, I'll go straight to my midwife and let her know that I've missed my period. When she checks and I'm pregnant, I start my antenatal. I get my antenatal card because my first time I visit the clinic, my antenatal labs will be done for me. And with that, either random blood sugar or fasting blood sugar will be done. That will give a baseline information about my as a pregnant woman so that my midwife or my doctor will have a fair idea of who I am before I start my journey and I finish by the 9 months. I also know that, or we've also learned that when you are pregnant, the crucial moment starts from 20 weeks to 28 weeks. That is when the sugar can start escalating. So it's advisable that during that time, when you go for antenatal and they check your sugar, and the sugar you start previously was negative, negative, you start getting trace and plus, and you are being referred to a nutritionist or a dietitian, please go, because that diet plan can save you and save the baby. We also know that when you are pregnant, possibility that you as a mother, if you are diagnosed with gestational diabetes, 5 years to come, you can be also diagnosed with type 2 diabetes if you don't take care of yourself well, if you don't adhere to the management, if you don't adhere to your diet, if you don't adhere to all that you'll be told at antenatal counseling and education. Is always done to mothers. We also know that when you are pregnant, from 20 weeks to 24 weeks, if even during that time, from the beginning, you don't like exercising, you don't like taking rest and sleep, we encourage you to do that, because that time is very, very crucial for you. And if you are the fan of immediately you realize you are pregnant, you like doing your exercise, continue. 30 minutes a day wouldn't hurt. And always when you get to the workplace, please don't sit at one place for long. When you sit for some time, try and stretch and come back and continue your work. And have enough sleep. When it's time for you to sleep, sleep. It will help you. Somebody will say, when you are pregnant, when it gets to 30 weeks and above, you urinate frequently. Yes, it's true. That's why you need a pot or a bowl or a pail near you, so that the pail wouldn't be far from your bed, so that you can equally get down, urinate, and come back and sleep, so that at least your 8 hours sleep, you wouldn't miss it as a pregnant woman. We also encourage that you elevate your legs anytime you are resting. It's good for you and it's good also for the baby. We are also saying that those who are at risk are those who have suffered heart disease before, those who are obese, those who have been diagnosed with polycystic ovarian cyst, those who have a history or a family history of diabetes or gestational diabetes. We are also saying that mothers who are diagnosed with diabetes in pregnancy are likely to give birth to babies who are macrosomic. So those babies are fat, those babies are big, those babies are huge, and those babies weigh more than 4.5. And also, the best time to save you a baby is between 36 weeks to 39 weeks. We are also saying that as a mother, when you get pregnant, there's joy home, irrespective the mode of delivery, either by vaginal birth, assisted vaginal birth, or by cesarean birth. At the end of the day, the priority is to save mother and baby. So, anyone that is being recommended, please don't hesitate. Just go for it and have your baby and have yourself, so that you can enjoy that precious moment with your baby. We are also saying that today, we hope every mother who is pregnant will be diabetes free, hypertension free. But it all starts with prevention. If you are able to prevent it, you wouldn't go. And we are also saying that prevention is better than cure. So at Kassum's Baby, we are saying that we love you. We care so much about you. And we know that everybody has a part to play because that baby can be the future president. That baby can be somebody who will discover something that can save the world. That baby can be someone who will be a great person in future. So we want that baby to live healthy. We also say that those babies' possibility that they can develop heart conditions are high. So let's prevent it. Possibility that we can even lose the baby before the baby is born is also high. Possibility that we can lose the baby after birth is high. And we don't want to lose anybody because Kasum's Baby believes that every baby can be saved and every mother can also be saved. On behalf of my crew, on behalf of PZ Kasums, on behalf of Kasum's Baby, we say we love you. We'll meet again next month to have a wonderful session, as we always do. On my behalf also, I say to all mothers, belated Happy Mother's Day. We say we love you so much. Words cannot express how much we love you, but we love you. Bye.